Our mission at Joliet Hematology Oncology Associates is to provide exceptional care for our patients, which goes beyond our excellent clinical skills. We believe in treating the person behind the patient. Everyone is impacted by cancer. It's not just the patient. His family, the caregivers, and the community at large are all impacted by a cancer diagnosis. Being surrounded by a dedicated and caring staff, we are able to provide the best care in a warm and comfortable environment for the patient.
Joliet Oncology Hematology Associates, more commonly known in the community as JOHA, is a multi-physician practice in Joliet, Illinois, a suburb of Chicago, that has provided quality cancer care since 1981. When you choose JOHA, you get the university hospital experience in the heart of your community.
When they told me that I had lung cancer, it was probably the most devastating thing that ever happened in my life. And as far as JOHA is concerned, my doctor and I hit it off right from the first meeting. But he explained the history and the treatment of lung cancer. And he said 18 months ago, he says your chances wouldn't have been too good. But he said in the last 18 months, cancer treatment has improved so much that I now stand a very good chance of being a cancer survivor instead of a cancer victim. The best part of this facility, JOHA, is the way, it's hard to express, but is the way that people take you into their hearts.
Our oncology nurse navigators are here to guide the patients and their families through their cancer journey, from the time of the diagnosis, treatment planning, during treatment, and on their road to recovery. We are here to be your ears as you hear so much new information in medical terms. We will be there to educate you on your new cancer treatments and support you in your decision making. We are there to help refer you to other services, including transportation, a clinical licensed therapist, financial assistance, wigs, and other wellness programs. Upon completion of your treatment, we will provide you and all of your healthcare team with a survivorship care plan.
We have laboratory services on site. The laboratory is capable of doing testing that is available for the physicians and for the healthcare workers to be able to treat you for your continuity of care.
Good nutrition is a critical component of cancer treatment. Good nutrition helps to maintain weight, rebuild blood counts, keep strong immunity, and keep activity level up for during cancer treatment.
Until recently, there has been a lot of improvement, especially in the immune therapy, and that now immune therapies are generally changing the oncology area completely. For example, lung cancer. If you have a metastatic lung cancer, average patient barely lived 1 year on the previous clinical trial prior to the immune therapy. Now this immune therapy is changing the lung cancer prognosis completely. Immune therapy works with many different areas, not just the lung cancer. Melanoma works very well with the immune therapy. Kidney cancer respond very well to the immune therapy. So there are many areas we still keep trying.
Our on-site pharmacy is a convenient place for our patients to get all their pharmacy needs met. We collaborate with physicians and nurses to offer fast, compassionate service. Patients have a one-stop place to receive their IV therapy from our infusion pharmacy and outpatient prescriptions from our retail pharmacy.
Radiation is important treatment in complement with other surgical and systemic or chemotherapy treatments for cancer. It's important from the earliest stage cancer, stage 1 and stage 2, to those that are more advanced, like stage 4, where the treatment goal is not curative, but rather is to improve symptoms or quality of life. We have 3 different radiation machines. Depending on the patient and the appropriate treatment, we choose the machine that's best designed for each specific patient. And so we're able to really customize the treatment for each patient as an individual, given the situation.
Clinical trials are at the heart of medical science advances. We have been participating in clinical trials at JOHA for the last 20 years. Our goal in conducting clinical trials is to help determine if these treatment approaches are safe and effective. Our collaboration with Northwestern Medical Center started back in 2010, offering us access to a variety of clinical trials to offer to our community. Our dedication and commitment to our community was proven by being chosen to receive the Clinical Trial Participation Award, which was only presented to 3 cancer centers within the United States. In addition to providing clinical trials, JOHA also has JOHA Foundation. This is a charity arm of JOHA. The purpose is so we can provide support to our patients while they are undergoing this treatment.
The physicians at JOHA decided that it's very important for cancer patients to have a multidisciplinary conference. So we set up a group for the breast cancer patients that you would see all your physicians at one time. We did that at a women's center, so you would have a medical oncologist, you would have a radiation oncologist, you would have a surgeon, all see you on the same day.
As a physician, I probably had a lot of knowledge going into my own cancer journey. I saw many patients who had very excellent care in the community, and so I knew from the very beginning as a physician that I would seek out the best care that I could find when I had my cancer diagnosis. It was a very different experience for me being on the other side, being a patient after being a physician for 38 years. I then understood what patients go through when they have a cancer diagnosis, and it wasn't easy. I remember having my care here initially and talking to Dr. Gustafson, and she insisted that I go downtown for a second opinion, which was very wise on her part. And so I'll never forget the day that we went downtown, my husband and I. Very stressful, fighting the traffic, finding the big complex at the University Center, finding the right building, finding parking, finding the right floor for the cancer center. As I sat there, I thought, I cannot do this. I cannot be at a facility this large, so impersonal, and I knew that I would never go back there for my care. I wanted my care in my community with doctors that treat the whole patient, that give them state-of-the-art care in a very caring and compassionate environment. We have excellent, state-of-the-art, quality cancer care right here in our community. You can't do any better than staying here where you have people that are dedicated to treating you and treating the whole person. You have a whole team that is devoted to you with personalized care. You don't need to leave our community to receive the best care you could possibly get.